Seen the huge problems in our health system during the COVID-19 pandemic, the massive strain it's been under. We also have a shortage of doctors and nurses. To get proper health care is a major struggle for many people. Within all of this is a conversation around what's called digital health. I suppose you could say it's getting technologies to help people more cheaply, more efficiently. Jacqui Stewart is the CEO of the Council of Health Service Accreditation of Southern Africa. It's a health NGO. Jacqui, good afternoon to you. I mean, when you talk about digital health, I do need to start with what exactly are you talking about?
Good afternoon, Stephen. Digital health covers a massive range. It's everything from using mobile phones right the way through to big data. It's everything. But I think it's about how we use technology, all different types of technology, to support healthcare, to improve access to healthcare, to improve the quality of healthcare, and improve the communication between practitioners and practitioner, and indeed between practitioners and patients.
So, I mean, on one level, it could just be using Skype or Zoom to actually communicate with a doctor who's far away from you. I mean, that could be where it starts. That would be the individual experience for a patient, for example.
Exactly, yes. And then it can move up to, there's robotics. There's just so much development now that is happening. And I think in Africa, we've got the opportunity to improve access to quality care. We know that we're short of doctors, we know we're short of specialists. So if they can be in remote contact with other doctors to provide backup and care to patients, that's got to be a good thing. That's got to be improving the quality of care.
I mean, there are all sorts of ways this can work. On the one side, you can, with a cell phone now, take a really great photograph, depending on the phone, of a condition, a skin condition, or whatever it is on your body, and send it to an expert who can be a million miles away. That expert could probably have a pretty good chance of diagnosing it correctly just on that very high-quality photograph. They know what to look for.
Absolutely, absolutely. And I think we've got massive penetration of mobile phones in the continent. So it's a way of using it. And there's some great examples already. There's a system called Mom Connect, which keeps pregnant women in touch with the system right up until the baby's born, and then when the baby's up to a year old. So, it can be very simple technology. And at the other end of the spectrum, it can be the robotic surgery.
For all of this to work, you do need data. And you need it available, it needs to be relatively cheap, it needs to work really in the places where you don't have doctors. So I'm talking probably in our continent in sort of more rural areas, in our country in more rural areas than in more urban areas.
Yes, absolutely. And I think my passion obviously is quality of care. And I think we've just got to look at ways of making digital health accessible in such a way that it improves the quality of healthcare, whether you're in an urban setting, whether you're in a rural setting, because that's the important factor. We can improve access, but if when you get through the door, the care that you get is of poor quality, you're really no better off. So for me, it really is about how we use the technologies to support quality and safety as well, safety of practitioners and safety of patients.
Is it having a big impact now? I mean, I can just see the scare story of one doctor unfortunately misdiagnoses something because of an issue with the photograph, and then everyone will push back against it. But, I mean, are you actually seeing a change yet?
I think there has been a massive change. I mean, there's an association of digital health now in South Africa where organizations are coming together to say, what is the best practice? How do we make sure that digital health is safe? And that, I think, has been a great step forward. And I think it's one of the benefits of COVID. I mean, we've had to learn to do things remotely. I run an accreditation organization, and we weren't able to go on site to do accreditation surveys, but we wanted to make sure we were still in touch with our client organizations. And we've now converted all our training to remote training. We can do what we call interim survey, which is when we just check they're maintaining the standards during the program. We can do that remotely by transferring the information digitally and then using technology like we're using now to have an interview to check that all those things are in place. So I think COVID has really helped. It's certainly seen an increase in remote consultations with doctors. And I'm sure the doctors will say they're not maybe 100% as good as having the person there in the flesh, but in the absence of that ability to see people in person, they are providing good quality care.
You spoke about the use of big data earlier, and I presume what you mean is using a whole lot of information to put it together to get an accurate picture of a situation that is developing. And I mean, perhaps the best possible example is those incredibly clever people who make predictions about waves of COVID-19. And I mean, I was sort of amazed to speak to professors on this program and have someone actually predict with a startling accuracy, when the peak of a wave will be, what it will look like, how many cases hospitals will have to deal with, all of that sort of thing. I mean, that's the kind of thing you can do with big data, can't you?
Absolutely. And I think, again, COVID, it's happened in other areas, but I think, as you say, predicting the waves of COVID has really helped our health services to plan well for what is coming. And I think we have to give absolute credit to our hospital services. They have been, I mean, all healthcare, the healthcare frontline have been amazing through COVID. They have, re-engineered their services in a matter of days. They have redeployed staff to make sure that patients are cared for. So I think we've got to give them absolute credit for the amazing work that they have done. And that was because of good planning, good data.
Jacqui Stewart, thanks very much indeed. Do appreciate the time. CEO of the Council for Health Service Accreditation of Southern Africa, Health NGO.